I'm Dr. Jessie Gold. I'm a psychiatrist in the department. I see WashU Direct patients in my clinic, and I also am the Director of Wellness Engagement and Outreach in the Department of Psychiatry. So I get to do a lot of these talks and talk about mental health and wellness as it comes up. I'm excited to talk to you guys today because we've done a lot of work trying to expand the psychiatry department and what we're doing for employees, and it's fun to talk about for me. I clicked on the Q&A button on accident, sorry. My objectives for this talk is to briefly talk about what we know about mental health in the country, but focusing mostly on a little bit of the WashU data that we have. Discuss some of the warning signs of when you need to get help for mental health, and then discuss what resources we have at WashU and navigating some of the nuances of that. I like to start all of my talks with this cartoon, partially because it's funny and partially because I feel like how are you is pretty stressful right now, because it used to be just a question that we asked when we were talking to people and thought it was just like common conversation, and people would say, fine, I'm okay, how are you? And now it's really weighted and we don't even want to ask because then we have to know the answer. Because people don't like to talk about emotions. As a person who prescribes medication, I like this cartoon because it says, can we up the dosage? I still have feelings. Because people don't like feelings, because feelings get in the way, and they get in the way of work, they get in the way of parenting, they get in the way of everything else you want to do. So when I start all of these conversations, I like to start with this because it's important that we think about how we check in with ourselves and how we're doing, why we're feeling the way we are. And for me, I would say I'm somewhere between these two things. My surge capacity is depleted, and that's why I feel awful. And we should stop saying that everybody's okay and it's totally okay not to be okay. And I think that these two feelings are pretty common. And a lot of people that I've been talking to feel like this too. And so I like to put that out there at the beginning because I think everybody's been feeling like this. This is pretty normal. And this is like a good just smattering of headlines that shows how normal these feelings are, which is literally any group of people that you could pick out, any subgroup is going to have some headline that says they're having bad mental health right now. I just picked all of these to show you that anything you're feeling is normal. There are no typical emotional responses to a pandemic, with systemic racism, with the upcoming election, with working from home, with all of the stuff that we're dealing with. None of that is typical, and anything that you're feeling is completely normal. This is what the data says. So this is the best data that we have for the country, which says that in June, which is a long time ago now, we had depression symptoms in like 31% and anxiety symptoms up in 31% too. And that was, the depression symptoms were about 2 times what they were previously at that same time last year. Hard to exactly compare, but they tried. And anxiety symptoms about 3 times that. And then started or increased substance use, 13% of people. Seriously considered suicide in the last 30 days, 11%. That's double from before. And having trauma or like PTSD kind of symptoms were 26% of people, which is also increased. These data were different depending on certain groups that you were a part of. So unpaid caregivers, it was worse. Frontline workers, it was worse. Young adults, it was worse. And specific minority and ethnic groups, so Hispanic populations and Black populations had worse mental health outcomes as well. So these numbers were larger. Also, I think it's important to point out that this has been significantly stressful for women and for pregnant and parenting moms. If you look at just the bit of data that we have in new moms and pregnant moms, depression increased from 15% to 40% in one study, and anxiety went from 29% to 72%. That's a lot. Parents with a child under 18 in one study, a good chunk of them are reporting that their kids felt like they were having changes to their health and their learning as a result of COVID. And then because of that, the parents were feeling stressed. So the parents were having anxiety and depression symptoms because their kids were stressed and because their kids were having a lot of these changes, but also because they're experiencing anxiety and depression themselves. feeling like they had control and feeling like they had support was associated with lower stress, which I think makes a lot of sense. And what do we know about this in WashU frontline workers? So this is all initial data, but I thought it was important to put in here so you guys could see what some of those surveys that you've been filling out actually say. So the surveys in the medical residents and clinical fellows at WashU showed that we have high rates of anxiety and depression in that group. The people who work directly with COVID patients had higher stress and burnout, higher stress regarding childcare, and lower work-family balance. And then the women were more likely to report stress, and unmarried trainees were more likely to be depressed and anxious. In pretty much across the board, like any study that has been done so far on the pandemic, women bear out as a subgroup that is affected, and so do the group that is like directly working with COVID patients. The Empower study, which is that one that's come in a couple waves that you've filled out, has shown that we have moderate to high stress, pretty decent amounts of anxiety, pretty high rates of depression, and more significant rates of work exhaustion, worsened overall well-being. And then that's the people who are working in clinical settings and caring for COVID patients. Again, higher stress, anxiety, burnout, and work exhaustion. And then all of those outcomes are associated with supervisor behaviors. So if you feel like your supervisor is more supportive, you're less stressed. And if you feel supported in your work-family balance, you also are less stressed, which again, is kind of the same as that other study, but I think makes a lot of sense. So how do you know that you need help? I really like this quote because I think it has a lot to do with the medical population, or pretty much anybody who works in this whole field that we're in, which is just because someone carries it well doesn't mean it isn't heavy. We do a lot to mask emotions and to just do our work and to do what we're supposed to do, but that doesn't mean we aren't struggling. And I think that's really important to think about. So what does that mean? I have so many people who come and they say, I'm just exhausted. What is exhaustion? So exhaustion is actually anxiety a lot of the time. So yes, it can be exhaustion because there are plenty of people who are not sleeping right now, and that is totally reasonable. But it also can be anxiety, and that's because basically anxiety evolved when we were like evolving as animals to be a response for us to predict threat and to run away from a threat. So we said like, I might see a dinosaur. I'm picking dinosaur because that seems like the animal that maybe was there when we were evolving. So I think there's a dinosaur that's coming and I need to run from it. And so all of my muscles prepare to run. My heart goes faster so I can run. I'm breathing faster so I can run. And I sort of am just prepared to do that. Also, if there isn't actually a dinosaur there, we get kind of used to this like prediction of the environment that a dinosaur would like. So we scan our spaces and our environment for what might be a place that is a place where we could get hurt, really. And in someone with anxiety, you're over predicting an environment that you could get hurt in, and you're overrunning. So you're just running kind of all of the time. And that is why you're tired, because you're basically just running a marathon consistently, and that's exhausting. And so when you feel like you're tired, that's why. I think it's also important if you put all of these symptoms in context, like evolutionarily, it makes a ton of sense. Like if you sleep, then the dinosaur can get you, right? So that's why you have bad sleep when you're anxious, you know? Or if you think about something else, then you might have missed something. Like it's possible that in that ability to sort of figure out if that environment was dangerous, you might have missed something. So that's why you're constantly worried. So a lot of these things like make sense within that context. And I think it helps you kind of understand where all of that's coming from physically and why you feel the way you feel. What other things besides feeling exhausted are warning signs that you might need help? So social withdrawal. Socializing right now is super weird. Don't get me wrong. It's not the same way that we socialized before, but If your friends or family or anybody's been asking you to do stuff and you don't want to do that, even if it's 6 feet apart with a mask, and that's not appealing to you in any way, that might be a warning sign. If you're really angry and snapping at people more than you usually are, or just irritable, like things are bothering you more than usual, if you just have less empathy for people at work or at home, that might be a sign. So I think people often forget that just kind of being, for lack of a better word, pissed off is a sign of anxiety too. Attempting to cope by using substances, including alcohol. So at the beginning of the pandemic, there were a lot of these like conversations like, I'm just going to have a drink after work and that's just the way it's going to be. It's been 6 months. So if you have a drink after work every day, that's a lot of drinks. But also not everybody can have just a drink after work. It becomes 2 drinks and then it becomes a drink in the morning and then it becomes, something else. So that's something to watch, amount, how often, if you're craving it, if you can't go without it, that sort of thing. Not sleeping or eating, or sleeping or eating too much. Basically kind of either flip side of the coin. Loss of pleasure. That sort of means like if you were to read a book and you would have usually liked that book and you're bored and you just can't enjoy it, or like you put on a TV show and you usually would have laughed when you watched it and you just don't enjoy it. That's important. Trouble concentrating. There are lots of things pulling our attention right now, like kids, dogs, the leaf blower, the video chat. So you're going to have trouble concentrating. But if you're just like consistently unable to focus, like you can't look at the screen, it just doesn't feel like you can pay attention at all, that might be something that's worth paying attention to. Hopeless thoughts. Those are more like wishing you never woke up, wishing you died instead of someone else. That's more something you might see with guilt, or if somebody died recently, suicidal ideation. So having thoughts that you would end your own life, which becomes more serious if you come with a plan or intent to actually carry that out. When does all of that kind of, those warning signs become something that you might then need to go get professional help for? It's very complicated in a pandemic to answer that question. So usually we would have these kind of arbitrary time courses. We'd say like 2 weeks for depression symptoms, 6 months for anxiety symptoms. Like how bad is it interfering with your life? How severe are the symptoms? Those things can still be benchmarks. And I think it's important for them to still be in your mind as benchmarks, but it's super hard to keep them as the only benchmarks, because what is baseline anything in a pandemic? So our whole system is kind of flipped upside down. But I think it's important to still say, okay, I have these symptoms. Is it impairing my functioning? Is it impairing my ability to go to like school, work, or my family and my relationships? How long has it been going on? If you can't sleep for a day, it's fine. Lots of people can't sleep for a day. If you can't sleep for like 2 weeks, that's more of an issue. Like that's really going to start to affect your functioning, right? We use the words excessive and marked a lot in our definitions. That just means you're having more of a reaction than maybe your neighbor would to the same problem. Hard, again, to know exactly. But you can kind of judge if you see your spouse or a friend reacting to something and they're not as anxious as you are all the time about something. But I think it's really important to keep in mind, especially during the pandemic, that not everything needs to be given a diagnosis and not everything needs to be pathologized or treated, but we just need to say like a lot of these reactions are normal because this is hard and this is complicated, and it's okay to be anxious and it's okay to be sad, but not everything needs to be diagnosed and treated. Other things that we need to talk about are, there really is no wrong time to get help, even though I said not everything needs a diagnosis, because you don't necessarily need a diagnosis to go get therapy. Therapy especially is something where, to me, everybody could benefit from it. It's something that you're going to talk to someone who's not your spouse, best friend, significant other, about the things that you're struggling with. It's an independent observer. But not every single symptom that you have requires professional help. You can help your friends and colleagues by doing a lot of like normalizing and validating, which is what I was doing, which is all of these things are common and normal, and this is what we're all experiencing. We can also learn and practice using coping skills. So a lot of things like journaling or like practicing breathing techniques or using mindfulness can be helpful in the acute moments, and like you can practice those, and that can be helpful when you're dealing with stuff, and that can help decrease your stress, and you don't need to go get professional help to learn that all the time. Trauma itself has no timeline. I think it's possible that people will start to see symptoms months later or even years later, and I think it's important for you to realize that. Just because the pandemic ends, you might still feel bad, and that's okay. That's not something wrong with you. That doesn't mean that you're reacting in a way that's abnormal. That's just the way that mental health works. It's not nice like that. Mental health also can manifest physically a lot of times. So besides insomnia, people also get stomach problems like nausea. You will see a lot of teeth grinding. So I've been hearing that dentists have been seeing a lot of people with this recently. So sometimes that can just be anxiety, and that's important to keep in mind too. So what are we doing about all of this at WashU? So when the pandemic started, we got a whole big group of people together to form a group to work on this. It was very important that we tried to figure out how to organize around employee support and wellness. And it was like the Department of Psychiatry, Human Resources, Department of Medicine, Graduate Medical Education, Social Work, and the DEI. And we basically were like, how can we figure out how to give immediate mental health care and wellness to healthcare providers, supplement the existing like EAP services, and then really find ways to embed mental health and wellness into the WashU conversation and culture where it really hasn't been embedded. This is a really long list of all of the people who are involved. Their pictures are really, really tiny, so it's hard to see, but it's a lot of people. What we did initially was we made a employee well-being support portal, which is just literally copingwithcovid.wustl.edu. On there, you can find a lot of the things that I'm going to be talking about. We sent out the WashU Together Care and Connection Toolkit. Initially, we also had a Coping with COVID hotline, which we provided over 1,000 hours of coverage and staffed with volunteer time. We actually transitioned that to the EAP number now and have worked with them on ways to answer the phone and make sure that they're appropriately doing that in a way that we feel was fine. And so we feel really good about transitioning that to them. We're working to update the Department of Psychiatry clinical care page so it's easier to understand, and it'll be easier to understand for you, and also to provide a wellness resource page there, and that'll be done soon as well. We have mindfulness Zoom sessions, and we've done about 800 people have done those over the past couple months. We also have Zoom support groups, and there's about 10 of those. And on the website, there's also a library of like self-care apps, which could be helpful if you don't want to jump right into some other like group type of model. These are the current groups that we have, which are all available on that Coping with